Live now to Ottawa, where the federal government is giving an update on the status of COVID-19 in Canada. Health Minister Yves Duclos is speaking. Let's listen in. Jean-Yves Duclos.
Canada has temporarily implemented pre-board screening requirements for air passengers entering Canada from China, Hong Kong, or Macau. As of January 5th, 2023, these passengers must provide their air carrier with a negative pre-board screening test result. In addition, upon arrival in Canada, travelers who have passed through these jurisdictions in the last 10 days are provided with additional public health information and information on what to do if they develop virus symptoms. These are prudent steps to take at this time, and Canada is not alone in this decision. 15 other countries, including the U.S., have adopted these measures. Our actions continue to be guided by caution, and we will not hesitate to adjust measures to protect the health and safety of Canadians.
The situation evolves, those border measures will be reevaluated. Our actions will continue to be guided by prudence, and we will not hesitate to continue adjusting them to protect the health and safety of Canadians. We're also putting in place additional wastewater pilot projects at the Toronto and Vancouver airports that will focus on direct flights originating from China and Hong Kong. Work is underway with industry partners, and these two projects are expected to start later this month. They will further enhance our ability to track the emergence of variants coming into Canada. These projects will build on the Pan-Canadian Wastewater Surveillance Network, which monitors the spread of COVID-19 in our country and is in collaboration with federal, provincial, territorial, and municipal governments, as well as with many experts across the country. Wastewater monitoring is a key tool for public health surveillance. It can alert public health officials to where diseases like COVID-19 and new variants of concern may be spreading. Earlier this morning, the National Advisory Committee on Immunization published their initial considerations for future COVID-19 booster doses for 2023. I thank NACI for their guidance. This is a good reminder that if you have not received a bivalent booster this fall or winter, it's not too late to get one and get better protected. Boosters remain one of our best defenses against the severe outcomes of COVID-19. We also need to protect the overburdened healthcare workers by doing everything we can to stay healthy. I thank Canadians for contributing to this effort by staying up to date on their vaccinations and continuing to practice individual public health measures, such as wearing a tight-fitting, well-constructed mask and staying home if sick. Earlier last fall, parents and caregivers were particularly concerned about their difficulty to find children's analgesics. As of today, 3.8 million additional bottles of these medicines have been made available to parents and caregivers through increased domestic supply and foreign importation. I also wish to inform parents and caregivers that a major pharmaceutical company, Alon, estimates that an additional 1.1 million bottles will be available at pharmacies and retailers across Canada for the month of January. This is very encouraging news, as we are starting to see some good signals that the overall pediatric analgesic supply situation is starting to improve. We will obviously continue to work very closely with all our partners, including manufacturers and provinces and territories, to address these shortages both in the short and in the longer term. Cela m'amène au dernier sujet.
This brings me to the last topic requiring an update today. Through the interim Canadian dental benefit, first available to children under 12, the Government of Canada is helping to reduce financial barriers and help families access the dental care they need. The application process for the benefit began on December 1st, and as of January 11th, more than 90,000 applications have been approved, representing nearly 146,000 children who will be able to get their best smile and protect their health.
I didn't give a short update on the discussions taking place between the Canadian government and the provinces and territories on healthcare investments. These discussions continue collaboratively in the best interest of patients and healthcare workers. 5 fundamental areas of shared priorities are our common focus: reducing backlogs and supporting our health workers, enhancing access to family health services, improving mental health services, helping Canadians age in dignity, and modernizing our healthcare system, in part through a better use of data to save lives and increase the quality of care to Canadians. As the Prime Minister has said, we are confident that we're going to get to a good place. I'm personally very optimistic, and I'm looking forward to significant and positive developments in the weeks ahead. Les discussions entre les provinces et les territoires.
The discussions between the provinces and territories on investments in healthcare are proceeding well. We continue to work in the best interest of patients and healthcare workers. 5 fundamental areas of priorities are our focus: reducing backlogs and supporting our health workers, enhancing access to family health services, improving mental health services, helping Canadians age with dignity, and modernizing our healthcare system, among others, by improving through better use of data, to save lives and improve the quality of care. As the Prime Minister has said, we are confident that this collaborative work will allow us to enhance our public health care system and make it accessible for all Canadians. Thank you. I'll give the floor to Dr. Tam.
Bonjour à toutes et à tous.
Hello, everyone.
First update of 2023. I hope that everyone had an enjoyable holiday season. Public health activities have raised everyone's awareness of healthy habits and ways of living. Let's capitalize on that and focus on preparedness for future public health events, including protecting ourselves from COVID-19 and other circulating respiratory viruses. The latest data indicates that COVID-19 activity continues to fluctuate across the country, while both influenza and RSV have settled into expected seasonal levels. However, the healthcare sector is still recovering from the pressures of these viruses in our population. For this reason, it is still important to do everything we can to prevent severe illness. In its statement released today, the National Advisory Committee on Immunization, or NACI, reminds us that booster doses of COVID-19 vaccine are an effective tool to reduce the risk of severe illness and death. Taking measures that reduce the likelihood of hospitalization remains important for all of us, since it subsequently affects health system capacity. If a full booster was recommended for you and you haven't got it yet, now is a good time to get a bivalent booster. As we continue to monitor national and international data, including COVID-19 disease rates, but also contextual information like the level of immunity in the population, we are seeing an increase in the proportion of sequence detections associated with the XBB.1.5 variant. Through whole genome sequencing of clinical specimens, XBB.1.5 is known to have been circulating in Canada at 2.5% during the week of December the 25th to January the 2nd. This proportion is projected to rise to approximately 7% in Canada by mid-January. While XBB variants are expected to increase in Canada, it is not known whether they will become the dominant lineage. Nationally, the absolute number of cases is not surging at this time, nor is there evidence of increased severity with this or other new variants. In 2022, the Omicron variant resulted in the highest numbers of infections in Canada to date. Fortunately, over time, there has been a general trend towards decreased severe outcomes, such as critical care admissions and deaths among hospitalized patients. This may reflect the impact of vaccines and infection-induced immunity, changes in the characteristics of the people infected, and changes in circulating strains. Like the winter weather, it can be difficult to predict exactly what we're going to see next, but we do know it's too early to put away our winter coats and boots. Similarly, it's still too early to stop taking the personal protective measures that have helped us weather the COVID storm. At this time of New Year resolutions, public health remains resolute in our commitment to fostering health within our populations by promoting health, preventing disease, illness, and injury to achieve optimal health and well-being for all people living in Canada. Happy and safe Lunar New Year to those who celebrate. Thank you. Merci. Miigwech.
All right, we've been listening to the federal government providing their first update of 2023 on COVID-19 and the healthcare situation across the country. Dr. Theresa Tam saying that COVID activity continues to fluctuate across the country. RSV and those respiratory illnesses, they're finally settling to what they should be for this time of year. But we are seeing that surge in the XBB.1.5 variant, 2.5% between December and early January, expected to hit 7% of cases by mid-January.